Where are we today? What are we doing?
We're here at UCLA for the second annual California ALS Research Summit. It's a gathering of all of the top ALS researchers in California, plus we have some people from Harvard and Pennsylvania and other real leaders in the world's ALS research community here for 2 days to talk about ALS and how to treat it.
What do you hope comes out of these summits? Because this is the second time we're doing it.
This is the second summit, and what we found that came out of the first summit was it was really the first opportunity to gather these researchers together in the same room. And what comes out of that is new ideas, new questions, new ways of thinking. So it's exciting for us as the ALS community to actually watch the scientific process work, where they're exchanging their ideas, they're asking themselves questions that have never been asked before, and that leads to new discoveries.
How would you say something like this rates in the scale of importance to people with ALS and their families?
Well, we all want a cure, and a cure will come through research. And so there is nothing more important along that pathway than bringing the research community together to figure out a solution to this problem.
And in your opinion, you know, we've talked to a lot of experts today who told us that this is a very exciting time. From their own mouths, they told us, I have not seen a time like this in ALS research. What are you hearing from all the national chapters, the international communications that you do, keeping on top of all the research? What is your opinion about all that, where the research is right now?
Well, in the 8 years that I've been involved, I have never heard so much great news about ALS research. The old talking point of there's nothing we can do, that's gone. The new talking point is we have more clinical trials happening in California than ever before, we have more discoveries than ever before, and we have more opportunities, more targets for research than ever before.
And other than research, we've also got some exciting developments with legislators, with fundraising, with events that are just going on around ALS. Why don't you talk about some highlights that we can expect to see coming up or that are happening right now?
The ALS Association is committed to advancing public policy initiatives, patient service initiatives, and research initiatives. And all three of those programs are totally integrated. Legislation drives support for patients and funding for research. Research creates opportunities for clinical trials. Clinical trials happen in clinical centers with patients. And while those patients are there, we're taking care of them. So all of this effort is integrated. The Research Summit is an outgrowth of legislation we passed in 2008, creating the Lou Gehrig's Disease Research Fund as part of the California Tax Checkoff. That created the opportunity to consider how will we be investing that money in more ALS research. We need to bring the ALS community, we need to bring the ALS research community together to answer that question. We have a summit, the fund gets established, we invest that money in research, we have terrific outcomes from that research, we have another summit, and coming up on the governor's desk right now is our bill to reestablish the California ALS Research Fund. And so that will drive more money into our ALS research program, which then will be delivered to the scientific community who are here today to figure out what they should be doing with it.
You know, we've got things like the Walk to Defeat ALS coming up, and I mean, it's already happening. And by the time this video airs, that will all have already taken place. But I guess the point that I want you to make now is how right now is not the time to stop giving. And if anything, to keep this momentum going, we need more support than ever. So, you know, in the way that I know only you know how to do it, just a plea to everybody, not just wealthy donors, but to everyone about how they really need to jump on this train.
So the good news is we have more research opportunities than ever before. What that means for the ALS community is they have to give more than ever before, because it's no good having research targets if we can't pursue research to explore their potential. And so the Walk to Defeat ALS is one way that people can get involved, and those families are raising millions of dollars that go right into patient care, right into research, right into advancing our public policy initiatives. It's an exciting time for ALS research. We need to have the wherewithal to fund that research. We have more scientifically valid projects for ALS research sitting on a shelf than ever before. The only way we can pull that research off the shelf and get it done, get it working for a treatment and cure, is to create the funding for it. And that's where the community comes in, because the funding from the ALS community is driving progress toward a cure.